Neutered. Minnie's a rescue, and I'm going to do her neutering for free so she can get a good home. She does have a good home, but she's got big eyes and sad eyes. Wouldn't you love to have this little dog? She's got a home now, but she was in a shelter. Minnie, are you going to be neutered now? I know, you're scared and that dog's whining. So we gave Minnie a little bit of pre-medication to calm her down, and then we're going to take her into surgery, and we're going to give her an anesthetic and prep her and get her all ready for her neutering, her spaying.
So Minnie's in the surgery now, and what we're going to do is we put alcohol in her veins so her vein stands up, and an assistant holds her. They don't like it though. They'll pull back when they put the needle in. They're not in intense pain, but they do feel it, and we feel bad for them, but we have to get the job done. We put tape on so the vein doesn't bleed. Don't worry about that dog back there. It's waking up from anesthetic and it's whining. Then you can see Minnie's getting very relaxed. The injectable anesthetic's now taking effect, and then what we do is that one will wear off in just a few minutes. But now we want to induce her, get her stabilized and anesthetized under the gas anesthetic. So we put in a trachea tube into the windpipe, and the veterinary technician very skillfully puts it right through, and you can hear the breath coming out of the tube. That's a sure sign that it's right where it's supposed to go. And she's starting to breathe very hard because she's trying to cough it out. But that kind of helps us because in the beginning, when they start breathing in the anesthetic, then they breathe it in really rapidly, and it actually makes them go under anesthetic a little faster. So you can see the bags moving. That's the mix of the oxygen and the anesthetic. And the valves are the things that are fluttering, and that shows that the oxygen and anesthetic's moving in and out. And then the technicians will make sure everything's going well. They monitor the color of Minnie, how she looks. They monitor, they start to put all the instruments on to monitor her breathing and her heart rate. And then we check the color to make sure it's nice and pink. That means the oxygen is getting to where the blood's through the lungs and then out to the tissues. And you can see Minnie's kind of staring straight ahead and relaxing. She's not breathing as hard anymore. There's the anesthetic concentration. It's at 5%, and we will decrease it down to 1% later on. That was us telling the dog to be quiet because we had surgery, but it didn't pay any attention. So we're going to hook up all the electrical monitoring devices to monitor the heart rate and the breathing rate, so that while we're doing the anesthetic and the surgery, we can concentrate on the task, and the machines will monitor the oxygen supply. Like this pulse oximeter. It's on the tongue, and you can see that little red laser there, and it will tell us what the oxygen percentage is. Anytime it's above 90, it's good. And the heart rate's really high because what happens is when they first go under anesthetic, it usually goes pretty high. Well, now we're going to we clipped up the body so that we can get the hair off where we're going to make the cut, because hair is hard to clean. We want baby, soft, non-hairless skin in order to soap it up and clean it up with disinfectants. And we're always monitoring that heart rate and oxygen rate. We use an anesthetic solution, soapy solution, and we start in the middle of the incision, and then we go to the outside and scrub it in a counterclockwise or clockwise position.
Why do we neuter dogs? Well, we do neuter dogs because dogs are introduced from wolves, and we design them into our friends and companions and working dogs. But we can't let them run willy-nilly all over the place and breed like rabbits. And you know how rabbits breed. So we need to neuter them to keep them from overbreeding and overpopulating. Also, when we neuter female dogs, it reduces the amount of breast cancer they get, and also reduces the chance that their uterus will get infected. Like if we call it pyometra or pus-filled uterus. Doesn't that sound appealing? So what I'm going to do is show you what happens when we neuter a female dog. I'm in my scrubs. I'm going to don my mask, and I'm going to scrub my hands because I don't want my dirty bacteria to get in her clean body. So I'm going to scrub up, and then I'm going to do the surgery. So I'm coming into the surgery room and with clean hands and trim fingernails and sterilized instruments. These are my instruments, and then I also have stainless steel instruments. I'm going to put on my gloves, and we'll get started with surgery. Yeah, this sterile drape I'm going to put on her because it'll help shield and prevent me from touching anything dirty. So I'm going to put it on her and just leave open the part I'm going to do surgery on. So now see, I can put my hands anywhere and I won't get them dirty. So you can notice too, her mammary glands are a little bit filled up because she might be having a little bit of a false pregnancy. So here I'm going to make the cut, and it's right on the center midline, and it's just like that. You notice not a whole lot of blood comes through, because if you cut in the right places in surgery, you don't get a lot of bleeding. So we're going to cut right down between the abdominal muscles. We're going to find a little place called the white line, which is right there, which the abdominal muscles are attached to. And if I cut right through that, then you'll notice that it doesn't bleed. So I'm going to cut, there I cut through it, and I'm going to enlarge the incision a little bit, and then down in there is actually the internal organs. There's the spleen, there's a piece of intestine, and I'm going to put my Spay hook, this is a Spay hook, and it will hook the uterus and it'll bring it out. And there's the ovary right there, and here's the uterus, and I'm going to break through the window of the mesentery, and here's all the blood vessels coming up in from the body into the uterus. And I just use little clamps because this is a little tiny dog, and I'm going to clamp above the ovary and below it. And I use this clamp to hold on, and then we're going to put a ligature around that area to tie off the blood vessels. So the ligature goes around the blood vessel coming from the body to the ovary, but we have to tie it off because we don't want it bleeding, so we're going to put a ligature in it. A ligature will tie off the blood vessel. So we put it underneath that instrument. That knot goes right on the blood vessel. And then we start with one knot, one loop, and then we keep tying so that it stays tight, because you put a lot of knots in there because you don't want it slipping. It would bleed. And that would be a bad thing. No bleeding. And then we're going to cut the ligament and the vessels that go to the ovary. So now that ovary is free. This pedicle, we call it, or the results of what I cut, I'm going to check it. So I'm just going to grab onto a little tiny piece like that, and then I'm going to see when I release that if it's bleeding. It's not bleeding, it's happy. It's happy, I'm happy. It goes back in the wound. Notice there's not much bleeding except where I cut. Isn't that great? So now I'm going to try to take out the other horn. Look at it come out like that. So if I pull, it'll come out, and that's the other horn of the uterus. Dogs have a lot of room in here. that's why they can have a lot of puppies, because they got a lot of room. So I see me spin that around, sometimes they get tangled up like that. So there's the ovary, there's the oviduct, there's the ligament between the ovary and the uterus, and here's the uterus. And you can see the uterus has got this membrane in there. This membrane prevents the uterus from tying itself in the knot. And look at how pretty the vessels are. They're going up. It's like a little river, red river, coming from the mountains and going out into a delta and going into the ocean. Same principle. You want all this blood to be able to service this whole organ. So it starts out with one branch and it branches out into a lot of little small branches as it goes all through the uterus. I think it's so pretty. I'm going to put my finger in this one. It's a little tight, so I'm going to break the ligament right that's holding the ovary to the body. So see, now that ovary comes out more. I'm going to break through the tissues that hold it together. And I'm going to put my little clamp. Usually I use a bigger clamp, but this dog's so small, I'm just going to use a little one. Got to clamp it like that. Clamp it on the ligament so it holds nice and tight. And I'm going to put another ligature there, like I did, right there, to hold off the blood vessels from the body. Tie off the blood vessels coming from the body. So I take my little absorbable suture. What this suture does, it'll go away in a few weeks. But by then everything will be clotted and scarred in and we won't have any problems. So I'm going to tie that around just like I did the other one. So it's a nice little knot. Notice there's no bleeding yet, is there, hardly? So you probably thought once you cut into the body, blood just comes out everywhere, but it doesn't it? It's amazing. And for those of you that write me that say blood makes you nauseous, sometimes if you watch something for a while, it won't. So if you watch these videos and you find yourself getting used to the blood, then that's a good thing. So here's the ligature. I'm going to cut the vessels and the ligament that comes from the ovary. Here's the little pedicle, we call it, or what's left. And stick a little, I'm going to clamp it like that so I can check it, make sure it doesn't bleed, take stress off it. Look, it's got little antennae like a bug. Got to put it back in. And then this is the rest of the uterus. See, you can tell. Looks like that. There's one uterine horn. Here's the other uterine horn. Here's both ovaries. And the cervix is right down here. Piece of suture. We're going to loop it around the uterus in front of the cervix. And we're going to tie it off. Like so. So this is the uterus and ovaries. See, it goes, isn't that a lot of tissue? But that will prevent this little dog from getting breast cancer, getting unwanted pregnancies, and get pussy uterus. So I'm going to check this again to make sure it's not bleeding, make sure it's happy, and then it goes back in its little house. So now we're left with just the incision. Got to sew through the muscle, sew through under the skin and the skin. And grab up, this is the muscle, your abdominal muscles. I put a suture in on either, or the needle through on either side. And we don't tie too tight because remember, this is the body. And this isn't a ligature like I put in the ovary. We want all this to live, so it's just a gentle, we just put it down to where it seats it together and holds it tight, but does not pinch it off too much because we want the blood to get in there and we want it to heal. In about a week it'll be really strong And after a few weeks, this suture will dissolve away.